Susie, when the presentation is being given, you're gonna put your camera on that.
Yeah.
Good evening. Please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. Please call the roll.
Supervisor Quigley,
Present.
Councilwoman DeGroot, Councilwoman Hayner,
Present. Sorry, I don't know what that means.
Councilman Schatzel,
Present.
Councilman Van Cleef.
Thank you very much, and welcome to the Town of Ulster Town Board meeting for Thursday, August 21st, 2025. Safety announcements. Please note the fire exits to the left and your right. Please exit in an orderly manner if necessity calls for it. And usually I would say follow the chief of police out, but he's already left. Are there any additions or changes to the agenda? None?
None.
We have a couple of discussion items that I will add at the end. Ladies and gentlemen, it's the point in the meeting where we invite the public to make comment on the items that appear tonight on our agenda. Is there anyone here tonight who would wish to comment on agenda items? We will be having a second public comment session after we complete the agenda for anything that anyone here wishes to talk to the town board about. None? Thank you very much. Ladies and gentlemen, in our package and has been previously distributed are the minutes of the Town of Ulster Town Board meeting for July 24th, 2025. May I have a motion to accept them?
I make that motion.
Do I have a second?
Second.
Is there any discussion on the minutes as presented? All those in favor? Aye. Any opposed? Motion carries. Ms. Reeve, the item is communications.
There were no communications tonight?
Nobody wanted to send us any letters, huh?
No love letters.
Okay. Ms. Hayner, abstract of claims.
Yes, we have our abstract of claims is $758,758.85.
May I have a motion to accept the abstract as presented?
I'll make that motion.
Do I have a second?
I'll second.
Any discussion? All those in favor?
Aye.
Aye. Any opposed? Motion carries. We have the abstract being circulated for signature.
Yes.
Very good. We will, even though it's on the agenda, budget modifications and transfers, there are none for this month. At this point, we have a presentation by Dr. Eve Walter, the Public Health Director for Ulster County Department of Health. Ms. Walter will be speaking from the podium and receiving AV assistance for her presentation, which is on the TV.
Thank you. Thanks for having me here, and you all for being here for this presentation. Yeah, I'm Eve Walter from Ulster County Department of Health. I've been going around to the different towns and villages in this county
You
to.
speak into the mic so the
Sure.
people on the internet can hear you.
Absolutely. Sorry, people on the internet. Oh, there we go. So I've been going around to the towns and villages in Ulster County to talk a little bit and introduce people to all of the services we do at the Department of Health, because I've kind of found that not everyone really knows the depth and breadth of what we do. And then a little bit about what we do here in your town. So, first slide shows that the Department of Health has been here in Ulster County since 1947, so it's a long time. With a mission to protect, promote, and improve the health and well-being of all residents in Ulster County to achieve the best quality of life in all stages of life. Next. Just a right click. So, some people, probably a lot of people don't realize, but local departments of health are arms or extensions of New York State Department of Health. So we're mandated by state law to perform certain services. So we have Public Health Law 602. And the good and bad of this is, the good piece is it allows us to really actually, the really good piece of it is a lot of what we do is funded by the state. We get what's called Article 6 funding. And so unlike many of the departments in the county, very little of our programming comes from county dollars. It mostly comes from state dollars. The negative side of it is because of this, we are restricted in some of the things we do based on state law. So we can only regulate what we can regulate, and there are some aspects of public health that maybe fall outside of our actual capacity to regulate because it's not within the parameters of this state law. But what we are required to do, and this is a mandate of every local public Department of Health in the New York State, is to deal with communicable disease control, chronic disease prevention, environmental health, family health, public health emergency preparedness, education on public health issues, and development of public health policies. So I'm going to show you how the different divisions that we have address these requirements, plus where we go above and beyond that. So these are the different divisions in the Department of Health, and the ones that are in dark orange reflect the ones that are exactly what the state mandates have for us. So that's our Family Health Division, Community Health Division, Public Health Preparedness, and Environmental Health. In addition, we have in Ulster County the grant for women, infant, and children. In different counties, different entities hold that grant and do that program. In Ulster County for many, many years, it's been the Department of Health that provided that service. And then we have a medical examiner's office. Counties have an opportunity, well, depending on the size, on whether they have a coroner or a medical examiner, we have a medical examiner's office. So I'm going to break down each of these for you now. So you could go next. So our family health services, we provide immunizations for free for adults and children, for individuals who are either have no insurance or are underinsured. By underinsured, I mean if your insurance will not cover the full cost of that immunization, we can provide it to you for free. We have our nurses are starting a program of doing home visits for high-risk births. We did this a long time ago and then it stopped for several reasons, and I'm sure COVID was a part of it, and we're bringing it back in. So this is if a mom had gestational diabetes or gestational hypertension or premature birth, our nurses will go check in on mom and the baby, see how they're doing, with the motivation of helping the mom get back into care, because oftentimes after a delivery, the medical needs of the baby are focused on and the mom forgets to take care of herself. We have a sexually transmitted infection STI clinics. So we have these every other week, so twice a month. Our immunization clinics are every week. Our STI clinics are every other week. So if we identify someone as an STI, we also cover their treatment. In addition, if someone has an STI that comes to the attention of a doctor, we are told, we'll reach out to the person, make sure they're getting the treatment, and identify if there's any other people that we should be reaching out to. Also for tuberculosis, we do those clinics so people can come and get tested if they're concerned about tuberculosis, and we oversee the treatment. In addition, if someone is identified as having tuberculosis, we are told, and tuberculosis is the kind of infection that needs to have medication and isolation for, 5 to 8 days. I keep forgetting and I should find out before I do my next presentation. But our nurse will go every single day to the isolated person's house to give them the medication and until they are clear from that. Next. Our Women, Infant, and Children's Program, or WIC, does nutrition for mothers and children up to the age of 5. We do SNAP enrollment, breastfeeding education, and nutritional education. SNAP can be achieved in other ways. Department of Social Services also provides SNAP. Others, FQHCs provide SNAP. What's nice about the WIC program is people who are enrolled in WIC get an app on their phone and they can scan the QR codes in a grocery store or supermarket, and it will tell them if it's SNAP eligible, so they don't have to go through the embarrassment of going up to the cash register and finding out that some of those items are not available to them. And these are my team of nutritionists. Next. Our environmental health program division is our largest division. There's about 25 or close to 30 people in this division alone. So we protect the public water sources and approve water and septic plans for new development. We ensure safe food preparation, your restaurants, your mobile food vendors. You have an event here. All of those mobile food carts have to be permitted by us and inspected by us. Every single day of the event, so the event's 3 days, our people are out there every single day checking on those mobile trucks. Ensuring safe children's camps, public pools and beaches, safe migrant farm worker housing, mobile home parks, and temporary residence, which is just the fancy word for hotels and motels. Next. Sorry, my back is to you. So we also have lead poisoning program. We have technicians who will go out and test for lead. There's a couple of ways that people get involved in this program. Actually, here is any of the town of Esopus in the 12401 zip code?
Town of Ulster.
I mean, town of Ulster. Sorry, my
Is it
we
the
are.
12401 zip code?
You are, okay. So now I can say there are 3 different ways because it's only true for the 12401 zip code. So there's 3 different ways for the lead poisoning prevention. The first one is anyone can just tell us that they're concerned about their home or it's someone else's home, although we have to get permission to get into the place. And we will bring our sanitarians or technicians down to test whether there is lead present. This is totally voluntary, but the challenge is if we find lead, it stops being voluntary. Now we are going to require that remediation is done. We'll work with the owner on a remediation plan, but we would have to find someone if they don't actually remediate. We can't know there's lead and ignore it. The second way is if a child is identified through their doctor to have an elevated lead level, we in the Department of Health are contacted, and now that's automatically a mandated engagement. Our nurses will work with the family until the child's blood level is cleared of the lead or at low enough level. And then our technician sanitarians will go into the home, test, identify the needs, and work on getting that remediation. Starting in January, we have the 3rd, which impacts your zip code, which is our lead rental registry program. New York State is just rolling out this program where it will be providing us with every unit, for lack of a better word, that was in a building built before 1980. And if the building has 2 or more addresses in it. So that's how it's determining that it's rental apartments. It will give us this list. And we're gonna have to, by law, go to every single one of those and test for lead, unless we've already gone and we already know their situation, it's been remediated. Some of those may have already been, some of them may not actually be rental registry rentals. They just will give us the list based on the year of the building and how many apartments are on there. So starting around January, that's gonna kick in where we'll be doing that in the zip code. We also respond to rabies calls. So if somebody's concerned that they've been exposed to a rabid animal, there's 2 services we have. One, someone from our team will go and collect the animal's head. It's all they need to do the testing, and they'll test to see if rabies is present. Also, if a person is concerned about themselves, they can go to Health Alliance Hospital. The hospital contacts one of our rabies experts who talk through whether they think the exposure, the risk is actually there. You know, for example, we had one woman who the bat was in her basement. She had no contact with the bat. So this is not a situation where we're concerned that she had that exposure. It's not a pleasant prophylactic, medication to go on if there is. So we really want to make sure you need it. But if you do, Department of Health pays for it, which is a significant cost. So it's helpful that we can cover that. We do testing of ticks. More often what happens is someone will call us and one of our people will talk them through, like, what's the size of the ticks? What does it look like? Maybe they'll send in a photo. We will test ticks, but it is not diagnostic for the person. It's really only for the tick, because an infected tick does not mean an infected person. A non-affected tick does not mean a non-infected person. And so we will test it for our own kind of surveillance, but we really work with the person on looking for symptoms and knowing when to go to the doctor. We also regulate illegal tobacco and vape sales. So illegal tobacco is the sale of tobaccos to minors. We have an individual under the age of 18 who will go to the different vendors and try to buy cigarettes. If they are sold cigarettes, then our person will go in there, issue an immediate violation to that place. They're also having their eye out for any vapes that are illegal here in New York State. That's some of the flavored vapes, not all of them, but some of them are illegal. And there's a whole slew of vapes that come into your businesses from China that don't go through our system, that are totally unregulated, and those are not allowed. So if we see them, we issue violations for that too. Next. Our Division of Community Health, this is where we really do our engagement with the world outside of the Department of Health. So we have our Healthy Ulster Council, Ulster County Coalition. So that's working with different agencies across the county that are interested in and connected with health. We also do media education and awareness, radio, TV, billboards, buses, social media, and presentations and fairs, events, organizations, and schools. So who went to the Ulster County Fair? Anyone? Did you get a cooling towel from us? So we had two things at the Ulster County Fair this year. One was cooling towels, and we had a nice cold bucket of ice water. And these are really awesome. You get them nice and wet and cold, and you can wear them around your neck or around your head. And it was insanely hot the first 2 days of the fair, like up to 100 degrees. So it was really nice walking around and seeing every fourth person with a nice bright green cooling towel. We also had our nurses there doing blood pressure assessments, readings, and then anyone who was at risk of hypertension, we sent them home with a free blood pressure monitor. We will also go to your schools, we'll go to your fairs. You have anything that you feel you want us to come to your people, we're happy to talk to you about that. Next. Public health preparedness. So we work in partnership with Ulster County Emergency Response. We're preparing for disease outbreaks. That includes emerging diseases, ones we've never heard of before, as well as those who have a vaccine. And we also look at weather-related events like the impact of flooding or fire, smoke. We work very closely with emergency preparedness. The MRC, Medical Reserve Corps, sits in both the Department of Health and Emergency Response. We do try to find ways of how do we work together ancillary, but not overlapping. So for example, if there's a flood with some power outage, emergency response is going to make sure everybody's on safe grounds, everyone's in a safe place. For public health, we want to make sure that anyone who has a chronic illness that, perhaps you have someone who's on a medication that needs refrigeration, we want to make sure if you have to leave your house or your power's out, that you have a way of keeping your medication safe. So, does anyone here know anyone who has a medication, maybe diabetes, insulin, or whatever, that has to be refrigerated? You do? Anyone else? Okay, so this is a medication bag that has a cooler in it so that it can stay nice and cool. It says medication don't leave behind, so if the person is stressed out and drops it, somebody's gonna pick it up and give it to them. Here you go. Next. Our medical examiner's office investigates death that may affect the public interest, such as sudden, unexpected, or unexplained deaths. We are fortunate to have our own forensic pathologist, who is our chief medical examiner, who conducts these autopsies here in Ulster County. Next. All right, so this part is a part that I enjoy. So one of the things that we do at the Department of Health is every summer we hire 10 aides, mostly in environmental health, but not necessarily only environmental health. And these summer aides have 350 hours, paid hours. It's a little over $18 an hour. And they will go out and shadow with the lead tests, camp inspections, pool inspections, restaurant inspections, working with the community health at fairs. So they really get a chance to be exposed. And I say this because every summer we hire 10. So if you know someone who, we've had college students, we also have sometimes teachers who are off in the summer who want to have this experience. So next year, when it's spring, look in the department, Ulster County's website. We will list our summer aid positions. And if you know somebody who'd like to work with us for the summer, that can apply, and we'd be happy to have them along. The other reason why I mention this is because they have downtime, and rather than them sitting in a corner on their phones, I gave them the task of creating the specialized set of slides for each town and municipality that I'm going to. And so it's nice for me because they all have their own special touch on how they do these slides, so I get to see that. And then I also bring this up because if there's a mistake, it's them, not me. So in the town of Ulster, for food service, there are 61 food service vendors that here in the town of Ulster, including 57 restaurants and 4 mobile food units. Next. We inspect and permit 10 pools and beaches here. And let's see if I can get the Ulster Landing, Marriott Courtyard, Lake Katrina Apartments, Wiltwick Country Club, Calabar, Hampton Inn, Holiday Express, Marriott, Skytop, and Sunset Gardens. Did I miss one?
Royal Garden.
I'll go tell them. We'll fire them. They're already gone for this. They're back in college anyway. Temporary residence and mobile homes. We permit and inspect 8 temporary residents and 6 mobile home parks in the town of Ulster. For children camp, there are 3 here that we inspect. Now, children camps are very complex because often at children camp, it's like we need to look at where the food is, where they're swimming, sometimes where they're sleeping, where they're going to the bathroom. So our camp inspections are often a team of people who are going and assessing it. That's the same true for many of the hotels. These things, there's a lot of different ways that public health can be threatened. So we bring in a team of people to do that. So here we have Calabar, Town of Ulster Rec, and Wiltwick. Next. In terms of water and septic systems, in the past year, we've permitted 13 water systems here and 12 new septic systems. And next. Okay, so in terms of strengthening our impact, the Department of Health, there's 4 priorities. One is to improve trust in public health. Trust has eroded in public health over the last 5-6 years. COVID was not helpful. I think a lot of the problem is when you get multiple messages from different people, it's hard to know who to trust. If we have a significant event that happens here, I really want to make sure that the people of Ulster County trust us and that they, when we try to message them on how to keep themselves safe, that they know that we are here for them. Also want to improve awareness of our programs. One, that's why I'm here in places like this and I'm going around the entire county. Knowing who we are helps you trust us, but also these are all services for you. And so if you don't know what we're doing for you, then you can't take advantage of it. The third is to identify and meet unmet needs. For the first time, the Department of Health has pulled together very, very granular data on hospitalizations, emergency room visits, deaths, other kinds of medical visits, so that we understand what's really happening in our county in its different pockets. We have a massive county, you all know it's bigger than the state of Rhode Island. It also suffers by the law of averages. On average, we're fine here in Ulster County. And so when you try to get grants or try to get programs in or try to figure out what's happening, on average, we're fine. Our pockets aren't fine. So by getting this granular information on a zip code level, maybe one of our communities has an elevated rate of hospitalizations for asthma. We would want to know that so that we can figure out what we can do for those communities. So without getting information down on a granular zip code level, we can't really know where our pockets of concerns are. And so we're pulling this together. By December, the state requires us to have a countywide community health assessment. We'll have this where you'll be able to look at a lot of the different conditions and see where your zip code lands. And that will guide our work that we do. But also going around places like this and having you meet me and know that maybe there is a need here in your town that I am not addressing, and having the opportunity to share it with me. So for example, I was at a town and they spoke about how they would love to see a program for senior citizens where having our nurses go and assess for fall risk. We don't do that. And so I wouldn't have thought of necessarily doing it because we do a lot and we're very busy. So it was really helpful to hear from people like, this is what's important in our community. I go to we have some very rural places out here. So they're sharing with me, it is too hard. We're not near any hospital or any medical center. What can you do to bring some of these services over to us? So always feel free to let me know what kinds of things that we could be doing. And the last is to be prepared to protect our county's health. Being prepared means I don't want the Department of Health to be making decisions about responding to something in real time. We need to be prepared beforehand. We need to be thinking about what supplies do we need on hand, what staffing are we going to need, so that if anything was to happen in our county, we're not just flying by the seat of our pants, but we have a plan in place. And so we're working on that. And with that, thank you very much for having me. I'm happy to answer any questions.
Questions from the board? I have a couple of points. On your slide, you talked about children's camps and you identified 3. We understand that there's a children's camp at Seat Song Farm.
That we don't know about?
And I believe your office was the one that confirmed with Warren that they had inspected it. But we were also informed this afternoon that there was an inspection by the health department yesterday in relation to some complaints about farm worker housing, and the location was shut down. So I would ask you to go back and look at the children's camp inspections in light of what they found yesterday when they did the inspections on the farm workers
So
housing.
just to clarify, so you're saying they're associated, the camp and where the farm workers, and because we saw problems with the farm workers, you want to make sure that there's not.
There were allegations of unsafe conditions for the kids in relation to exposure to the farm animals that were going on and that were repeated by several of the neighbors that are down in that locale. We have, as a town, been approached by constituents over the last year and a half over the permanent living facilities of travel trailers, which are illegal in our town. This summer, it's been reported to us that they graduated from travel trailers to actually living all summer long in tent camps. And that, those were reported to the health department, and I believe that they have been inspected and determined to be inappropriate. So issues like that have come up, and I had a discussion with the camp activity, the farms activity director this afternoon, and advised them that until they clear up their zoning issues, we will not be issuing any special event permits.
Thank you. So I will email you tomorrow to get the name so that I have it. Yeah, I mean, it's interesting. Sometimes these camps or other things do pop up and we aren't even told about it. And, you know, there was one where someone who had left Department of Health years ago was just driving and they noticed something and they called us and said, do you know there's a whole thing going on over there? So it's really helpful to have the towns, you have the eyes right on the ground, and to, when you see these things, letting us know, knowing like, if you go into a restaurant and you don't see that permit with my signature, there are restaurants that are operating without a permit. It's very hard for us to know if that restaurant opened, if we don't know that that restaurant opened. There's also some we've revoked the permits. And so, you know, the more eyes on the ground, the better to really inform us.
Thank you. No other? Thank you very much for your time tonight.
Thank you.
We have a follow-on presentation in reference to the Town of Ulster wastewater treatment plant to be presented by Alan Demas of Bernier and Larios and Vincent Majuri, our wastewater superintendent. This is in relation to the event that occurred in July of 2024 with our digester. We are in the process of designing a replacement and going to bid. And this presentation is designed to bring the board into the loop on where we stand in the process.
Good evening, everybody. So this, like Jim kind of mentioned, this is regarding the incident that happened at the Ulster wastewater treatment plant on June 29th, 2024, which was a catastrophic failure of methane piping that resulted in a failure of the digester system. And Alan and Kevin have a presentation on the new equipment that has been designed to retrofit the space available to us. And this system is elaborate. It's going to future-proof us, and it's a good fit to the plant. So I'll pass it off to Alan.
Hi, I'm Alan Dumont from Bernier and Larios.
Closer to the microphone, please, for the benefit of those out there in the ether world.
I'm Alan Dumont from Bernier and Larios. This is Kevin Delaney. Kevin and I have been working in consultation with both Vincent from the town and Supervisor Quigley from the town regarding progressing this project forward. As you know, the town sewer plant is on Dogwood Street Extension. It holds a valid New York State Department of Environmental Conservation SPEDIES, State Pollutant Discharge Elimination System permit. As Vincent mentioned, we had an overpressurization incident last year, which then permanently damaged our system. Current system is about 50 years old. It's a classic anaerobic, meaning without oxygen digestion system. Includes secondary digesters, heaters, etc. Basically what a digester does, for those of you that don't know, at a wastewater treatment plant, is you're taking the sludge and scum from the clarifiers and sludge thickener, and you're bringing it down to increase the solids content so you can dewater the sludge to basically then pull it off for disposal. Currently, the town has a primary digester, a secondary digester, a system of heaters, mixers, controls, piping valves, and appurtenances. There's really no option other than to replace this system. It's not practical to just basically pump and haul from our existing clarifiers as far as the solids that are generated. They're part of the waste stream. Replacing it in kind, I'll get this a little bit later. We've looked at replacing the existing system in kind. As I mentioned before, it's about 50 years old. To replace it in kind is probably somewhere in the neighborhood of 2.5 times more costly than the option we're looking at. So basically our option here is we're going with an aerobic digestion system as our selected alternative. And what I've got is we've developed, plans. This is a portion of the plans. The plans sheets so far, we're pushing 30 sheets. There will be more. Our goal is to get them submitted to the State Department of Environmental Conservation next week or the week after. We're wrapping up a few things with the manufacturer as far as expected materials we expect. We have also already submitted to the Department of Environmental Conservation a preliminary plan set and report to more or less get them to, we more or less vetted the project with them, so they are on board with, they know how we're moving forward. So with that said, just to kind of give you a quick rundown without going too much into detail. There. And both Vincent and Kevin will probably want to chime into some of the things I'm gonna say. But basically, nothing very much to say there with the cover sheet. This is your existing wastewater treatment plant site. As you know, our firm has been involved with the town's wastewater water systems for decades. This is the current site plan, which shows the whole layout of the whole system. The Esopus Creek being over towards Vincent. Our digester building is this one building right here that kind of looks like a set of Mickey Mouse ears. The plant consists of a series of clarifiers, submerged biological contactors, secondary clarifiers. As I mentioned, sludge processing. We worked with the board and the town wastewater department last year to install a new ultraviolet disinfection system to replace a system that was pushing 40 years old.
That one was from 99.
Okay, so these things do wear out. Unfortunately, in this particular case on digester, not only did it just wear out, it basically just went. So the work we're going to be doing is over in this area over here. Proceeding to the next page. I'm not going to bore the board with all 31 pages of plans, but I'll just go through it quickly. The area over in this area, basically, this is your digester building. This is where we had the overpressurization incident. We will be basically taking our primary digester and our secondary digester. This is our current primary and our current secondary. The existing secondary will become a primary aerobic digester. The existing primary anaerobic digester will become a secondary aerobic digester, and we would find these digesters with an air scrubber and a biofilter to help remove ammonia. This is a lawn area that's right behind the wastewater treatment plant. It provides both easy access for operation and maintenance as well as construction. It's also conveniently located in the plant's existing sludge press and drying beds. From a process flow perspective, right now, we have pre-treatment, primary clarification, submerged biological contactors, which are a secondary treatment process, secondary clarifiers. Sludge and scum is collected from that. It runs through degridding, a sludge thickener, into our digestion system I just mentioned, and then off to a belt filter press for processing and disposal. Or we still have the ability to use the old sludge drying beds, which are basically a gravity method of dewatering sludge. To dispose of sludge in New York State, you're typically dealing with required concentration of at least 20% solids by the Department of Environmental Conservation. And at the end of after the sludge is taken off, the effluent continues through the process, goes through flow measuring, and then the new UV system we put in, which we put in last year. What's going to change is basically all this stays the same, so I won't go through that again. We're going to be going to this unit called a thermair unit, followed by a cool air unit. The thermair is also known as an ATAD unit. The cool air unit is also known as an SNDR. Once again, after that, we're going to be following this with a belt filter press and then disposal. I grabbed this as part of the plans. In case the board isn't aware, last year when we had the overpressurization incident, sludge went down between the concrete wall of the building and the brick facade and basically blew out the entire brick wall of the windows. So we've already fixed this as far as the structural damage to the building, which is really more aesthetic and window functional than anything else. That's been repaired, but this is the backside of the building, kind of towards the creek. As part of the project, the reason I included this sheet is we are also going to be ripping off both roofs and replacing the roofs with precast concrete roof slabs. At the same time we do that, we will be redoing the existing roofing system on the building.
And that roofing system, when the overpressurization happened, it pushed sludge under the rubber roof membrane and through all the concrete roof panels into the building. So that's where it also pressurized behind the brick facade and pushed that off the building. So that is all gonna get replaced as well.
So in addition to the fact it was damaged and it needs to be replaced from time to time, and we're ripping things apart to do this project, we're basically gonna replace the two round digester vessels roofs with precast slabs, and then we'll more or less follow the original roofing plan for the rebuild of the roofing system. So basically what happens as far as the new sludge treatment is basically it goes through a thickener, through the therm air unit, through a cool air unit, SNDR unit, and then off gases drawn through a biofilter and air scrubber. This basically shows what's going on, kind of if you're looking down the roof, on the sky, with new piping on the roof. You're gonna see piping going from unit to unit, a couple of heat exchangers. This process creates heat. We'll be doing a lot of stripping of heat from the system. That is part of the process. I'll get to that in a few minutes. And then we have an air scrubber and filter. This is a blow up of the same thing. It shows fans as well. This is what's going down inside the building. I basically haven't pulled together two sheets on this. One basically gives some details as far as what's going on inside the current digester vessels. And the next sheet will kind of go show what's going on inside the building in the basement floor. Basically, what's happening is all of the existing equipment that's used to basically heat and mix the digesters is being completely replaced with this new process. So what we're showing here is basically a series of jet pumps, spray nozzles, and mixers, and other pumps as well. This is the same plan. It just really shows more what's going on inside the basement. Fortunately, when the plant was built back in the 70s, there is access to the basement from the first floor. There was a fairly large grated opening, which is used to basically put equipment down in and pull equipment out of the basement. So we'll be using that for this project for installing a lot of the new equipment. This is the first floor when you walk in the building. We're adding a sludge thickener, a series of blowers, once again, a lot of piping, valves, furnaces, controls. And that is, I have a full set. If everyone has any questions beyond what I'm showing, that was all the plans I really wanted to kind of go through. I also brought a copy of reduced drawings for each one of the board members that Kevin put together, which I can share with you as well. So basically, what will happen in the new process is the sludge gets thickened, it gets mixed in the digester vessels. We have a series, as I said before, of blowers, heat exchangers, filters for the ammonia. We're doing the roof slabs. As I mentioned before, we more or less have to do this project because the old system is no longer, it's functional and it's more or less being limped along by Vincent and his crew. We did look at other options, this being the lowest cost option. The current scope of supply that we've gotten from the manufacturer is around $3.4 million. By the time this gets installed and we do demolition and installation of new equipment, required site work, electrical work, structural work, we'll basically you'd be doubling that cost to somewhere in the neighborhood of $7.5 million. It's a lot of money. It sounds like a lot of money, but the alternative is going with the former system we have out there, completely rebuilding that to meet current code, and that would be about the cost we got was somewhere around $18.6 million. So we're trying to come up with a process that not only is more cost effective, But as Vincent mentioned before, it also more or less future-proofs the plant as far as changes in technology. So that's one big benefit is cost. Another benefit is, as Vincent said, and I just repeated, we're future-proofing the system. We're gonna have a decent reduction in electrical costs for the new system. We're staying within the existing footprint, other than going out onto the lawn, within the pavement area behind the building. We're not doing anything really new on site. Yes, we will be adding some pumps here and there, redoing some piping here and there, but the plant's generally gonna look like it looks currently. We're gonna be producing Class A biosolids. The nice thing about the Class A biosolids, and I'll let Vincent add to this, is they do not have the associated sludge disposal cost. They can basically be used as a soil amendment. They're suitable for various land applications, including both residential and commercial uses, with minimal restrictions. So in addition to the fact that we're gonna save some money on power, we're gonna save quite a bit of money over replacing it in kind. Getting rid of our solids should be much less costly in the future. I don't know if you want to hit on that at all.
Yeah, so Class A biosolids could be repurposed for stuff like making topsoil with the highway department. It can be mixed into the mulch. It could be sold to composters because it's already composted. So this process is also known as liquid composting. And one of the other key takeaways here is instead of using propane as we currently do to heat the digesters to produce this digestion process, this system we add air and the biological process creates the heat. The trick is here is managing the heat and removing the heat. And also, this system doesn't produce any explosive gas. So the old system, anaerobic, produced methane. Methane's explosive. It can be burnt. It can be used as fuel. It's a problem. It could be a liability. This system does not have any explosive features. It produces ammonia. It also produces heat, which is all the fans and the cooling process and the biofilters. So on a liability standpoint, we've reduced the liability of pressurized vessels. All of these vessels will be under vacuum actually, and drawn through a biofilter to scrub out any ammonia that's produced. So instead of producing methane, we produce ammonia. So it's a different type of treatment, but it eliminates a lot of liability and a lot of risk.
And as Vincent mentioned, the process generates a lot of heat, so we do really, to control the temperature, we will be stripping off heat, and we are working with another engineer on doing the mechanical work on this, which will be, how to basically operate another heat exchanger to help provide heat in other parts of the plant.
Yeah, we're gonna look to repurpose this hot water and pump it through the buildings and heat the buildings instead of using propane.
What we've done on the project is we've teamed up with a couple different people. Obviously, there's us in the town. The equipment is being supplied by Thermal Process Systems. Their representative is Kester Associates, who the town's dealt with on multiple other projects. And then from a design standpoint, we are bringing in a separate structural engineer, Steinmeier Engineering, a local structural engineer. And we're also bringing Gerard Associates, a local MEP, mechanical, electrical, plumbing firm, to handle that aspect of the project. So we've been trying to come up with the best team we can to more or less manage this project. So kind of going through a little more detail on the process. So in that first digester, it's a mouthful, but it's autothermal thermophilic aerobic digester. It's called the ATAD. That functions at a very high temperature. As Vincent said, basically we create a lot of heat breaking things down. It's running about 140 to 150 degrees. It's where most of the solids are digested. Typically our volatile solids reduction exceeds 50%. We drop the pathogens way down to low levels, which as Vincent mentioned, allows us to basically create a sludge that's more or less, much more pathogen free. And in this first unit is basically where we're meeting the requirements of the Class A biosolids. In the second digester, storage nitrification denitrification reactor, which the acronym is SNDR, operating more just shy of 100 degrees or 95, 98 degrees, removing a lot of ammonia produced in the first process, removing nitrogen, removing digestate, And we're lowering alkalinity and conditioning the solids for improved dewatering further down the process at your plant. The air scrubber, which comes after the unit, which is getting installed out in the lawn and consists of two pieces, basically draws air, as Vincent mentioned, the system runs underneath the vacuum, it draws air. Basically, the first unit removes ammonia, adjusts the temperature, spray some water to help keep, conditions desirable in there. The second unit has a specific media that helps remove odorous compounds containing nitrogen and adjust the humidity. So after the unit, there's specific equipment to basically not just eliminate not just to remove ammonia, but to help eliminate, odor potential. And then as I mentioned before, just like we're currently doing, once we go through this process, we go through the plant's sludge processing equipment. Once it's processed, it gets hauled off site. However, right now it's getting hauled off site and it's getting sent up to the western part of the state for disposal. In this case, we're producing a soil amendment that can be repurposed.
Several questions. You mentioned that Vincent and his crew was doing an incredible job keeping the plant operating. Are we at risk in any way of incurring a violation under our permit and being in compliance with the DEC regulations on our discharges?
Currently, we're meeting all permit limitations as far as the existing speedies permit. The DEC is aware that this is going through the project's going through the design process. They did review, as I mentioned before, the preliminary report and plans. It's not an approval, it's basically, it was sent to them so they knew what we were doing. Collectively, we had made sure that they understood the process before we proceeded to the design phase.
So we're not at risk of violating any of our permit requirements.
Not that I can see. They know you're moving forward in a positive direction, and they know you're doing this on your own without being under a DEC order to do it.
Okay, what is our timeline for moving forward? Just give us a brief overview. How long does it expect to get our complete package into the DEC? How long is it gonna take them for them to review it? And at what point do you think we might be out to bid?
So our goal is by sometime next week or the following week, we have this package out to the DEC. We received more or less most of the final information today. There's a lot of moving parts, as you can imagine. The plan set's currently over 30 pages. It will be longer by the time we're done. We're sending a full report along with the plans. We're also including every bit of manufacturer's information and specifications we can get our hands on. That will go to the DEC. That will take them a few weeks to look at. So if I had a guess, you're probably looking at getting comments sometime mid-October. Our goal is to usually turn plans around as quick as possible. So hopefully within a few weeks after that, have any comments addressed. While this is out of the DEC, our goal is to, at the same time, be moving forward in a parallel fashion on the structural design work with a sub-consultant, the MEP design work with a sub-consultant, in such a way that when we get the DEC approvals, that other work's complete. The DEC does not need to review the structural work nor the MEP work. They basically need to review and approve the process work. And Vincent and I have both been communicating with the regional rep from DEC, so they, so he knows what's going on, along with some of his colleagues. At the same time, we're working through finishing the other designs and responding to DEC comments. We are going to be trying to finalize all the bid documents and specifications. We got quite a bit of work done the specifications this summer. So I would say specifications on the civil end, probably half to 3/4 of the way done. And then I will be, once this package gets out of the DEC, I will be re-engaging the other two consultants to have them start working not just on their plans, but their specifications. So I would hope if all goes well, would you think by late the end, probably sometime fourth quarter? Yeah.
I'm not certain you want to be on the street during the holiday season.
I'd like to be on the street before the holiday season as far as getting some.
Getting a call for bids,
Yeah.
let them work on it on the holiday.
And what our plan is to do on this one is the same thing we did on the ultraviolet disinfection system. We did that as an emergency project. We have called this an emergency contract, so collectively, we will be going out to contractors that we know are capable of doing this type of work, to do quality work to get this work done. So our goal would be to get, a nice set of competitive bids and obviously recommend the lowest and most appropriate bid of the town.
Mr. Schatzel, would you care to comment on the seasonality of going to bid?
Are these gonna be all separate bids, the electric, plumbing, the structures? Or is
I'm
it gonna
not
be
sure
one
about,
package?
it's a good question. I'm not sure about the, mechanical piece, but the electrical probably would be. I have to get a bit more information on what exactly that, that cost is going to be, because one thing I didn't talk about, and I'm glad you asked the question, is obviously ripping off the roof system, putting on a new roof system is fairly straightforward, even though it's a different type of system. A couple of the units going behind the building, we're doing precast, so that they can be fabricated, like we did with the ultraviolet channel last year, and basically created on site. The one piece that is going to require a bit more research, especially as far as costing, is going to be what electrical upgrades are required to basically incorporate this design into the new plant. So for that, I can't give you an exact question on cost, an exact answer on cost.
And I would hope that we would be talking about digital controls. As Vincent says, the future proof this so that this becomes the backbone of a SCADA system that we eventually improve throughout the plant.
This system is an automated process, so not only does it have that capability, it operates under automation. So it automatically sees what's going on inside the tanks, changes valving, changes pumping directions, all kinds of different things to make this process happen. This is a very advanced system and it's state of the art.
And then Mr.
So-
Schatzel, I'm wondering whether we got an advantage going to market before Christmas or before the holidays, because it's a weak period of the year when everybody's hungry.
I agree.
I'd also like to get it out there before people start getting busy for the spring, because that way you have more contractors that can basically plan on the upcoming season. And the interesting thing with the supplier, and the manufacturer, Kester Associates is the supplier representative and the fabricator supplier, thermal process systems, is that not everything is going to show up at the same time. The total timeline for fabrication is several months, but as different parts become complete, that contractor is working out there, installing them. Another part of the process I should mention, as far as pricing is concerned, is that our goal would be to keep this moving forward in a positive fashion and to also save quite a bit of money, because we're talking about almost $3.4 million of the equipment we've gotten proposals on to date, is that the town does direct purchase on that as opposed to having a contractor do it.
Now, coordination with travelers, can you comment on that?
The next piece that will go to them is, once the package is ready for DEC approval, we'll also send it over to Travelers and to their consultant to review and just understand what's going on. But they've been kept in the loop the whole time.
Any members of the board have any questions?
How many times does the insurance company come out?
They've had, I'll say, well, between Travelers / their consultants, several times.
Anything recent? Have they seen this?
They have not
They've-
seen it,
They've seen preliminary,
seen-
yeah.
but we
So
also,
the preliminary drawings and preliminary designs that went to DEC
Mhm.
also was sent to Travelers and their consultants.
And they approved of it for
Oh, yeah.
$2 million more than we started at 6, we're now at 8. So they actually gave us like an unwritten check to go ahead and replace this.
The total price hasn't come in yet.
No, I just heard that from tonight,
Tonight,
preliminary meeting.
yeah, Alan stated 7.5 million
Right,
roughly.
so
is
it went
the-
from 6 to 8, that's my question, because I know how insurance companies work.
Okay.
That's all, I'm just asking.
Yeah.
Make sure when it's fully installed too and everything's done,
Mhm.
underwriting doesn't know what claims did, so make sure that you take a copy and send it. So
Right.
any of the new stuff, if you no longer have propane and you no longer have the issues that we're gonna have before, that might give us an insurance break by having an entire new
Yeah,
system.
they're aware of that. I've kept them in the loop on that and I've, you know,
Make sure you stay after.
advised them of the advantages to the new system.
And that goes with the new roofs too. If we're installing new roofs, we have to tell them that we have new roofs. Because they're not old
Yep,
ones
they're
anymore.
aware of all that.
We
They're
have,
aware of it, but whether they apply it, that's to be seen.
all departments were reviewed by the Travelers Risk Management Manager 3 weeks ago.
Correct.
Okay.
He spent the whole day here going through all the town's operations.
And at that point, I also advised him of this technology and of all of these upgrades that are coming and the reduction in risk and liability.
Ms. Hayner, any questions? Okay,
Sorry.
all right, thank you very much.
I'll leave you copies of them to do so.
Can I ask for a PDF of the board? Give us a board, PDF of the board so that we can put it both on our town's website and distribute it to the board. Thank you.
If you like the paper copies, you can take them.
Yeah.
Only because I don't want them to get thrown away. Sorry.
So this is just a copy of what we went through tonight. I did not read all 31 pages today, but you understand that's not even a full set yet. Sorry.
Thank you.
Super fun.
But no, in the future, digital into them. Okay.
All right, thank you.
Thank you, Jenny.
Thank you for
Thank you
everybody's
very
time.
Thank you.
Moving forward under new business on our agenda, the presentation and acceptance of the town clerk's monthly report for the month of July 2025. Ms. Reevy, while we were in the pre-meeting, I asked if you had any comments, and then I was informed you had stepped out, so I'm gonna give you the chance again.
I have no comments.
No comments. May I have a motion to accept the report as presented? Have a second? All those in favor? Aye. Any opposed? Motion carries. The next item is the presentation and acceptance of the town of Ulster's monthly supervisors report for the month of July. This was emailed out, the first week of August. It reinforces the town's ongoing financial strength and cash, and it specifically in the board package, it shows how our cash is, invested, both what institutions, how it's collateralized, and what the duration or maturity is of the investment. We are split between demand deposits at 42% and time deposits extending out for 2 years at 57%. And that is to protect the town from any potential decrease that the Federal Reserve may make at their next several meetings on the discount rate, therefore lowering the interest that the town would earn on its demand deposits.
Do you have any idea how much interest is it? I missed in here, how much interest we've earned so far to date?
Any idea? Can you get that number?
Maybe in the future, you just include it as an extra page for the virtual digital.
Okay. May I have a motion to accept the supervisor's report?
I'll make that.
No second.
All those in favor?
Aye.
Aye. Any opposed? Motion carries. The next item is, Chief Berardi's, which I will handle because he has not come back. It's a motion declaring certain police vehicles surplus and authorizing their sale. We have previously authorized the replacement of the, ESU vehicle, which is a Ford F-150 pickup. And the town general fund has been using a surplus police vehicle, which is a cruiser, which will now be replaced with a Ford Fusion, which will save us on gas. I'm asking for a motion to authorize the disposal and also to authorize the police chief to accept the bids in his discretion.
I make that motion.
I'll second that.
All those in favor?
Aye.
Aye. Any opposed? Motion carries. The next item is on behalf of the highway superintendent, who's not here tonight. It is a motion to purchase one Ferris mower. That is a mower used on the lawns here and at the parks. We were in the process of cutting the grass down the park the other week, and they had some problems and they had to replace the mower. It will be noted that the board during the pre-meeting asked about trying to rebuild this and keeping this as a spare, and that conversation will take place with the highway superintendent. So may I have a motion to authorize the purchase?
I'll second that.
Any discussion? All those in favor? Aye. Any opposed? Motion carried. Mr. Kovacs, do you want to spend 2 seconds on explaining the EMS stabilization fund coming from the county?
Certainly, Supervisor.
Wait, time's up, that was just.
This is the resolution 102, which is approved by the county legislature earlier this year and signed into law by the executive, provide a certain amount of funding to various towns and fire districts and across Ulster County to support work that many towns, and such as the town of Ulster, have done with retaining private ambulance companies, having municipal ambulance service. So this is funding about $162,000 that will be due to the town of Ulster upon the signing of this agreement. So I think it's a small step forward toward county support of our ambulance district.
Thank you. I want to note that this money was not budgeted in the 2025 budgeted. It will be rolled forward as a contribution from the general fund to the ambulance district to mitigate tax increases next year. And we are in the throes of the budget season at the present time. So may I have a motion to authorize the execution of this agreement?
I make that motion.
A second?
I'll second.
Any discussion? All those in favor?
Aye.
Aye. Any opposed? Motion carries. The next item, as you heard during the presentation on the sewer plant, there is what's called a belt filter press involved. The existing belt filter press is approximately 30 to 40 years old. There is a resolution in the package here to authorize the purchase of a belt filter press and associated equipment for the Ulster wastewater treatment plant at the estimated maximum cost of $732,800. This will be funded out of the capital reserve fund that currently exists and has an approximately $3.3 million balance in the Ulster sewer fund. And there is also in this resolution an appropriation of said money subject to a permissive referendum. May I have a motion to accept the resolution as presented?
I make that motion.
Have a second?
I'll second it.
Any discussion? All those in favor? Aye. Any opposed? Motion carries. Ms. Hayner, on the matter of personnel.
Yes, we have Darlene Higley, part-time court clerk, non-competitive, non-union, a wage of $21. Darlene is being hired as part-time court clerk for Judge Bud Meyer's office at the rate of $21 per hour with no benefit.
Can I just ask, was this person interviewed by anyone on the board?
I met and had a discussion with the young lady. Would you call it an in-depth
I didn't ask for
interview?
any
No,
depth, just that.
no, I met her. And Ms. Hayner, would you care to comment?
Yes, same.
Can I,
Okay,
I'll make a motion to approve.
do I have a second?
I'll second it.
Okay. Any further discussion? All those in favor?
Aye.
Aye. Any opposed? Motion carries. Ms. Hayner, would you care to discuss or add to the discussion the topic that we mentioned in the pre-meeting in relation to the confusion we had over the interview process?
Yes, I think we need to make sure that our policy is firm, that the personnel department is part of every new hire, whether it's part-time, seasonal, full-time, and no matter what department they're in or if they are under an elected official.
So we will be forming a resolution to be brought forth at the next meeting. And that satisfies all the concerns that the town board members have had in the interview process.
Yes.
Okay, very good. That concludes our scheduled agenda. We do have an executive session tonight for discussions regarding current litigation, Diaz versus the town of Ulster. But I know this is the point in the meeting that there's many people here tonight who are anxiously awaited and sat through those two long presentations. So I'm opening the floor to general comment by anyone. Please raise your hand, be recognized. Let me finish, Mr. Wahid. Be recognized, please attempt, do we have a sign-in tonight? Are you gonna present the pad for sign-in?
Yeah.
Okay, so we will have a sign-in sheet at the podium. Please write your name and address, and please attempt to keep your comments under 3 minutes. Now, Mr. Wahid, you may go.
Can we just reiterate that we are asking strictly that people keep it to 3 minutes so that everyone has time?
Yes,
And so we can
please.
get out before the lights go off.
You mean the light, that's right, the lights go on.
How you doing? I'm Mohammed Wahid. I own 454 Hurley Avenue, Hurley, New York, about 200 feet away from the proposed battery ion facility. I just wanted to give these papers to the board. And these photos.
Give one for everyone.
I'm missing one. So basically, in the town code, it says, a new project for special use can be detrimental to the site or an adjacent property. If you look up the definition of adjacent, it doesn't mean just touching. My property is adjacent to that property. It's 200 feet away. So it says also in the town code, shall not hinder, discourage the development or the use of the adjacent land. So if I want to put a gas station, like I mentioned last time, or if I want to do heavy auto repair, or a gas station and heavy auto repair in one, it's only 200 feet away, and I'm gonna have increased scrutiny for my project because of them. And not only them, Terrigen, across the street, I'm also adjacent about 50 feet to the Mission Energy proposal. So also during the appeals process, when we were in the lawsuit, when you guys hired the law firm from Albany to defeat me and stop me, you mentioned that my property is like a major fire hazard because I don't have a water connection. Okay, so I got a variance from the state, so nothing's changed. I don't have a water connection, nor do I ever need one. Okay, so you said I was a major fire hazard. Why would you even consider doing a project like this 200 feet away from a fire hazard? You guys submitted the court documents, not me. You guys said that. So are you changing your opinion on that now, saying that you falsified that just to stop me? But it's okay to approve that next to a fire hazard, right? So now, as I mentioned before, if you look at that piece of paper I gave you, it's page 10 of the environmental assessment form. I am adjacent. There's no argument. You don't have to touch a strip of land between two properties. That's an easement. I'm adjacent. So if you look at section H, potential contamination history, has there been a reported spill at the proposed project site or any remedial actions have been conducted at or adjacent to the proposed site? They put no. Okay? This is a fraudulent document. 100% fraud. Terrigen committed fraud right in this document. Okay? And if you even look at the bottom of that, it says, is the project within 2,000 feet of any site in the New York State DEC Environmental Site Remediation Database for contaminations? I've had multiple contaminations. I have like 3 to 4. You can look it up. I had to fill out the same form. I actually filled out the short environmental assessment form. This is the full one. On my short form, I disclosed the first thing I did when I was working with the planning board. Hey, I had contaminations, and then I even gave you guys the report, the 80 pages from the agent from the DEC. I even called the DEC, not to be like a snitch, just to ask a question, am I crazy? And they said, no, you're not, that's wrong. And we're gonna get them during the process of the permits. So you guys are the lead agency, and I'm one guy, and you don't find this before me? You know, this is a slap to your face. you know, for him to do that to you. And
Thank you very much.
You made your point, Mr. Wahid. We'll take your comments under consideration.
I appreciate
Thank you
that.
very
Thank
much.
you.
Next,
There you go.
do I have another speaker? Ma'am?
Hi, I'm Winnie Sobolowski. I live at 390 Joyce Lane, and I actually am reading a letter that my neighbor Steve Bauer asked me to read. He lives at 300 Joyce Lane. My name is Steve Bauer, and I'm a 20-year resident of Hurley. I'm not able to attend tonight as I am scheduled to work. I'm writing this to voice my opposition to the proposed BEST facility at the grounds of the Coleman campus on Hurley Avenue. I have 37 years in fire service, 25 of those as a professional firefighter. I am currently a captain with the City of Poughkeepsie Fire Department. I have many concerns regarding the proposed facility, but my main concern is a fire. In recent years, lithium-ion battery fires have been increasing at an alarming rate. I've been involved with many in my career, and they burn hot, fast, and extremely toxic. They are difficult to extinguish due to the self-igniting property of these batteries. It takes very little time for a battery failure from a small electric scooter to become a large-scale fire causing catastrophic damage. Electric car fires are another type of lithium-ion fire. These fires are extremely hard to extinguish, needing 25,000 to 50,000 gallons of water to put them out. It is advised that after the car fire is out, that the car be submerged for a week to prevent reignition. What is being proposed is thousands of times larger than any car fire. It will not be able to be put out. It will have to burn out. Since 2022, this company has had 3 fires. My understanding is that each trailer will have fire suppression systems, but systems fail and fail often. As a matter of fact, one of the suppression systems failed and damaged the batteries at one of the Terragen facilities. It is not a question of if there will be a fire, the question is when. And what is left will be a hazardous material site. When one of these lithium-ion trailers catch fire, the neurotoxins and carcinogens released will be a health hazard to all the community. Hydrogen fluoride, hydrogen cyanide, carbon monoxide, and heavy metals are just a few of the toxins in the smoke from these fires. Hydrogen fluoride, which can attack the calcium in bone, turns to hydrofluoric acid when mixed with the water used to fight the fire. This has potential to get into our drinking water. Some of these poisonous byproducts are heavier than air and will not dissipate. This is the reason for the quarter mile evacuation. Some have stated the smoke from a residential structure fire to be more hazardous than a lithium iron fire. Yet we don't evacuate a quarter mile during structure fires. Evacuating hundreds, if not thousands of people from the surrounding area will be another task. With many apartments within a few yards and 2 schools within a half mile, this will be a chaotic scene and expose those trying to escape. Terragen's own spokesman, Mark Turner, stated that the BEST in Valley Center, California, which has had a fire, was chosen because it was remote. Hurley Avenue is not remote. Higher energy bills, possible water, ground, and air poisoning, and lower property values for nothing. The electricity is useless if transmission lines are down. I know Terragen is making high dollar promises to surrounding communities, but tell me how much a life is worth. Look around and decide which of your friends and neighbors you want to expose to these deadly chemicals. Because if this goes through, that's what you're doing. In the fire service, we have a saying, risk a lot to save a lot, risk little to save little. This seems to me to be risk a lot for nothing. I, as a shift commander, would not put one of my guys within a mile of here if it's on fire. There's nothing they could do.
Thank you. You're gonna leave that with us?
Sure.
Thank you. Any other comments on the back? On the right-hand side, ma'am.
Who's right?
It's right.
My right, yes, I'm sorry.
Hello, everybody. Good evening. My name is Donita Johnson. I live in Hurley, New York. Supervisor Quigley, Councilman Van Cleek, Councilwoman DeGroot, Councilman Schatzel, Councilwoman Hayner. You're all elected officials in the town of Ulster. You work for the voters in your town. Your only obligation is to the people who reside in this community, not to Terrigen. This proposed project not only comes with the possible ramifications to the town of Ulster, but to Hurley, to Kingston and surrounding areas in the county of Ulster. Instead of your focus being getting your ass suit off, and I quote, we are asking that you do what's right in this situation, as many other towns in New York State have already done. Finally, as we've requested many times before, we demand a positive declaration under New York SECRA. Provide a 90-day public comment period. Hold at least 2 public scoping meetings. I am asking for what I don't feel that we've seen, full transparency moving forward. This doesn't just affect the town of Ulster, but all of us who reside in Hurley, in Kingston, as well as possible effects to the entire county. Your loyalties should be to us, not to a corporation. Thank you for the opportunity to address you all again.
Did you have that for us also?
Actually.
Thank you. Now on the.
Good evening, Supervisor Quigley, members of the town board, and community members. My name is Jillian Freed. I live at 28 Raina Street. I'm here tonight to speak about the misclassification of the proposed battery energy storage system as a utility public company structure. When zoning codes were written decades ago, the term utility company structure was just a catch-all. It meant things like substations, water towers, or telephone exchanges. Facilities built and operated by regulated utilities like Central Hudson. But Terrigen is not a utility company. They are a private for-profit developer. They don't deliver electricity to your home. They don't serve the public directly. They sell into wholesale markets for profit. By calling Terrigen's Best a utility company structure, the town is treating them like a regulated public utility, but they are not. And that misclassification creates serious problems. First, it gives Terrigen a zoning shortcut, slipping in under rules never meant for this kind of facility. Second, it undermines our right to a full SECRA review. If the project is classified incorrectly, the environmental review is flawed from the very beginning. Third, it hides the real issue. This project doesn't serve local residents. It serves the developer's bottom line that fails the standard of public convenience and necessity. I want the board to know the Public Service Commission, PSC, has already shown how standalone battery storage is treated. In Holtzville, New York, the PSC gave a certificate with lightened regulation because the project operates as a merchant in wholesale markets, not a traditional utility. And lightened regulation means they get the utility label without the utility obligations. In June 2024, Staten Island, the PSC again found the facility was a merchant participant in NYSO and granted only lightened regulation. Even the state regulator does not treat these projects as classic utilities. Calling this project a utility company structure isn't just misleading, it misrepresents how these facilities are actually regulated. The applicant's letter cites public service law sections, but in practice, the PSC does not treat standalone battery storage like regular traditional utilities. In Holtzville and Staten Island, New York, approvals came with lightened regulation precisely because they operate in wholesale markets and not as utilities serving local homes. The distinction is crucial. It undermines the town's rationale for forcing this project into utility company zoning category. It's not a household serving utility. It's a wholesale market operator. It should not get a shortcut through zoning by being mislabeled. Lastly, I understand the town previously classified the Lincoln Park Battery project under the same zoning category, but repeating a misclassification doesn't make it correct. It compounds the town's legal risk. If that earlier decision was based on an outdated or stretched interpretation, then it is even more important you get this one right. A private merchant facility should not be mislabeled as a utility, just a bit a zoning shortcut. So I urge the board, don't let a loophole and outdated zoning decide the future for our community. A BES is not a utility company structure. It's a private industrial facility, and it must be reviewed and restricted as such. We deserve zoning that reflects reality, not corporate shortcuts. Thank you very much. I have this,
Thank
and
you.
it also has supporting legal references and citations.
Any other? In the back?
I'm Anna Chetnik. I live in Council Village, close to the proposed Terragen plant. I have a question to Mr. Quigley. Is this true that in any smallest defect of the batteries, Terragen batteries, will cause Central Hudson subdivision to blow up? Why do you push this calamity on us? Do we have to abandon our houses?
Do you
Because
have,
no
do you
one-
have technical references for the statement that you just made?
No,
That you can't.
I just heard the statement.
You heard that statement?
Yes,
Okay, but you can't provide me
no,
the information upon
no,
upon
I
which
heard this
I could
statement.
evaluate it.
I heard this. Terragen doesn't respect us. Terragen never responded to any of our questions or emails. And why to push this calamity on us? And there is new technology and new batteries storing energy for 110 hours. The technology is created by MIT in Massachusetts. There is a company which provides this type of energy, this type of non-flammable, non-toxic batteries. And they store energy for 110 hours, not 4 hours. Thank you.
Thank you. Yes, sir.
Good evening, members. My name is Charles Dyers. I live at 2946 Route 32 in Kingston. I'm a town of Ulster resident and I am a voter, and I appreciate your attention. I'm going to give you the abridged version of my statement. I do have a printed copy for the board.
Could you just, for our edification, give us a reference? You've stated your address, but what landmark is that near so I can understand where you are on Route 32?
It's 2 miles down the road from the Stewarts, where King's Pizza is.
Okay, you're across the railroad tracks.
Yes,
Are you in the proximity to Banner Animal Hospital?
yes,
Okay, so are you in proximity to the solar farm that's there?
yes, I am.
Okay.
Thank you. I stand before you today to express in the strongest possible terms objections to the best project proposed before this town board. This project is far too big and far too dangerous for the populated area, and it presents a substantial risk to the residents, property, and environment, not only for the town of Ulster, but for that of Kingston and Hurley as well. We are not guinea pigs on what is proposed to be the state's largest lithium battery storage facility. I do not believe the town is acting in the best interest of the people who elected you, but are instead acting as advocates to Alcazar, or AKA Terragen. And I find that unconscionable. I no longer trust the board and call for an immediate declaration to be given to the town, or I call for a moratorium followed by a positive declaration to give the town enough time to secure proper EPA reviews and include relevant agencies that have not been listed in the previous forms. The town has asked us to trust the process. I do not. Because of the actions that this board has taken or for a better way of saying it, not taken, I think you have lost the right to ask us to trust in your word. The board is now in the process of completing steps 1, 2, and 3 of the Environmental Quality Review Act and approving the environmental asset form. Steps that are usually reserved for the end of the review process just before issuing a negative declaration. I do not trust this board at its word. You have completely ignored the repeated calls to declare a moratorium followed by a positive declaration. And again, I want you to, I will watch what you do and not what you say. The town must secure proper EPA reviews and also send the EAF back to Alcazar for revisions to include all relative agencies. Given the scale of this project, you must do everything in your power to protect not only this generation, but that of generations to come. And I would also ask, please do not call this a renewable energy project. It is not. Simply put, this is a foreign-based company working in conjunction with a fossil fuel industry to suck almost $900 million from the community over the next 20 years while destroying a group of towns we all dearly love. This, by definition, is corporate greed. And I thank you.
Mr. Dyers, I have a couple of questions for you. You indicated that it is in your belief that the EAF as filed is inappropriate because not all agencies are listed.
Yes,
Do you have a list of agencies that you would like to be included?
I know one specifically would be the Kingston Board of Education.
They don't have a decision to make in this process. They
do because what you do, if Terrigen is applying for payment in lieu of taxes, then that will affect the taxes that the Kingston School Board receive. It will also affect the Kingston School Board if and when there is an accident, the added burden when those properties are no longer usable, the Kingston School District will be asked to absorb those things.
Okay, so it is very clear under seeker who is an involved agency and who is an interested agency. The school district has, upon advice of their council, filed a letter with the town clerk to be recognized as an interested party.
They have asked, I spoke with the Kingston School Board, and I had asked them about being listed as an involved agencies, and they informed me that they were prohibited from doing so.
But that's not our prohibition. It is the state law's prohibition that prohibits them from being listed as a leading or involved agency. The second point I want to point out to you, sir, is that we cannot make either a neg deck or a pos deck under seeker without completing parts 1, 2, and 3 of the EAF. There is a process we must go through, that we must evaluate the risks before this board comes to a determination as to whether it should be pos decked or neg decked. Now, I would refer you to the YouTube video, I believe it, of the May 24th town board meeting, where we had our planning consultants here for about 20 minutes explaining to the community the secret process to be followed in this project. I would ask you, please give your comments to the town clerk, but please take and go another step and look at that video and try to understand what we are faced in following a process.
I do, but from what I understand, that at any point, the town board has the ability to declare a moratorium. That the objective of going through the process and declaring a positive declaration is so that you don't have Terrigen jumping through all of these hoops to keep amending their process that they've done a couple of times already. That you don't have them jumping through hoops before you say, no, hold on, we need other people involved. That's not fair to them and it's not fair to the community. So that's why that's done in the beginning of the process and not the end of the process.
That's your opinion, sir.
Yes,
Thank
it
you.
is. Thank you.
Additional comments? In the back?
There's one more behind the pole.
Can't
Yeah,
see
there's-
that.
There's two on this side. She's like right behind the pole.
Ms. Chetnik, you already spoke. Would you give somebody else a chance, please? Oh, okay, thank you.
Hello, my name is Jennifer Scott and I live in Hurley, New York on Orchard Street. And I simply want to state that I am opposed to Terragen building on this site, the Coleman site off of Hurley Avenue. It's too densely populated. It's simply not the right site. Thank you.
Thank you. And we had someone else on the right side. I'm sorry, I can't see you because of the poll, but come on up.
Hi, my name is Tracy Hazlett. I live at 112 Terrace Lane in Hurley. I've lived there for 24 years. And I'm just becoming educated about this. So forgive me if I misstate anything. I encourage everyone to become more educated who could be impacted by this. So I'm here because I am also against the Terragen lithium ion battery storage facility at the former Coleman High School site. From my perspective as a resident, the site is in a largely populated area of not only single-family homes, but also Country Village. We had someone represented from there tonight, and Stony Run Apartments, a 266-unit apartment complex. It's not only within a half a mile of Bailey Middle School and Edson Elementary School, it's also a little over a mile from Meyer Elementary School. It's in close proximity to 3 places of worship, faces Hurley Avenue with the thruway directly behind it. Therefore, a fire in this plant would lead to road closures, which could include not just Hurley Avenue, but also the New York State Thruway. There would have to be emergency evacuations concurrent with the mitigation of the fire. And speaking of the fire, and I'm just using AI for this because I'm not well versed in what a lithium ion battery fire is like. But according to AI, a lithium ion battery fire involves thermal runaway, a self-sustaining chain reaction of uncontrolled heating, which can lead to intense fires, explosions, and the release of toxic smoke and gases. These fires are difficult to extinguish because they contain the elements of the fire triangle: fuel, heat, and oxygen within the battery itself, with the internal electrolyte acting as the fuel and the heat propagating the chain reaction. The fires also pose a risk of producing large volumes of toxic gases and can trigger a cascading effect, igniting adjacent battery cells and materials. We saw this in the disaster at Moss Landing in January of this year, which burned for 5 days straight. So my questions are, and obviously not asking for an answer tonight, but just open questions. Do we have the first responders, the safety equipment, the mitigation equipment, the water resources, and the safety plan to handle a fire emergency of this magnitude at this site? Are we prepared for the lasting environmental and health consequences of a fire such as this? And given all of the potential negative consequences of a fire at this site, are there benefits that outweigh the risks? And at this moment in time, with what I understand in my mind, there aren't. Thank you for listening to me, and I just have rough notes. I didn't know that I needed to.
You don't
prepare.
need to, but
Okay.
if you wish to type up something, please email it to the town clerk.
Yes, thank you.
And then that way it's in the record
Mhm.
and becomes part of the secret process. As does every comment that has been made about this project since the first comment that was made in May.
Thank you.
Thank you. Are there any other comments? Jolie?
Welcome back, Mrs. DeGroot.
Thank you.
From your world travels. Jolie Dunham, Village
support Country Village. It's the dog days of summer, so our numbers are down a little bit tonight, but I will tell you that Winnie Sokolowski and I spent an hour and a half today going through the neighborhoods by Valley and Edson and meeting people and handing out flyers, and you see our signs all over the place. And I can assure you that as September progresses, our numbers will grow because people are really worried about this. They're worried because it's in a residential area. And I know so many of you, I'm standing here with a fervent hope and prayer that you would not do this to our neighborhoods. That it doesn't matter about the corporation, it matters about the voters and the people that live there, because I know none of you would want to live next to this facility. I know that. In my heart, I know that. But I'm just saying, I hope the research, that you're doing, we have groups and we share information, and that you're aware of the fires that were in Suffolk and Orange and Jefferson counties, in Warwick, these areas where they've already shown that there have been issues and problems with these kinds of facilities. There have been no long-term evacuation or no long-term health studies, nor are there any national or comprehensive safety standards for these facilities. And that is a big concern, but not to mention the long list of quality of life, environmental and health, and just it upsets me that I'm spending an August evening here, not that I don't mind being with any of you, because I certainly don't mind that at all, but that we're having to even be put in this position. Life is so difficult nowadays anyway, it seems, and now we have to fight to keep our neighborhoods safe, and it's kind of heart-wrenching. But I guess I'm asking you in my heart of hearts to protect us. We're your people, protect us. And I just wanted to ask for clarification. In the end, after all the processes, is it the board itself that votes, or does the supervisor have a say over the board, or is it, unanimous decision? How does that work?
Under the town code, it is the town board collectively on a majority vote that makes the final decision on this project, as it is for all projects over 2,500 square feet. And that is the way it has been for 50 years in this town.
Right, thank you for that clarification, and I'll sign and sit down, thank you.
Do I have any other comments? Just a couple of things to talk about tonight before we go to executive session. Over the last 3 days, there has been 2 incidences where the town of Ulster Police Department and the emergency services have been called out for a bridge jumper. I'd like to offer to the board for discussion whether you feel it is appropriate for us to contact the town of Rhinebeck to see if between the 2 towns, we can some way influence the New York State Bridge Authority to take corrective actions on the Rhinecliff Bridge to make some improvements that would prevent these incidences from happening.
100%.
Okay. So I will reach out to the supervisor in the town of Rhinebeck, Ms. Spinzia, and initiate the conversations on that. The second thing I'd like to say is that the town's parking lot lighting project is completed. When you leave tonight, hopefully the lights are on. Lastly, at the last meeting, we heard several speakers in the vicinity of Esopus Avenue speak about the conditions at the Seed Song Farm at the location of the former Chambers Farm down on the flats. You heard my comments to Ms. Walters about the activities that have taken place. Is Mr. Tutt here? Mr. Tutt informed me this afternoon that the Seed Song Farm has been shut down because of violations of state law as it relates to housing for their farm workers. It's the same violation that was called to our attention, which is that there were permanent structures, or sorry, travel trailers, which are prohibited under the town code being used as permanent year-round structures. There was no water and no sewer to those facilities, which created health hazards. And there were numbers of people sleeping in the fields in tents. And these, along with other issues that are related to the town zoning code, cannot continue on. We've had numerous complaints, particularly over the last couple of years, about issues such as 338 Glenary Boulevard, which we've wrestled with, and we are now in court and continuing to wait and move forward on the court. I understand the grass was cut. The front was not.
You got grass this high in front of the buildings and in the back, and against us. It looks good from the road if you go by quickly.
Okay.
Very quick. Yeah, you don't see.
And lastly, on the matter of the best, we are attempting to put together the resources that I'm hearing a lot of you ask for. And I have been in touch with both the EPA. I attended an EPA battery burning seminar last week in Albany, where they actually burned a battery. And I've also been in touch frequently with NYSERDA and some of the communities on Long Island where they're facing similar issues. And what they have done on Long Island is they brought in NYSERDA along with a panel of subject matter experts, not including the proposed developer. So in other words, we're hoping to bring in NYSERDA. We're hoping to bring in representatives from the fire services. We're hoping to bring in Central Hudson, although they have no part directly in this project, but just to allow you to ask them questions. And we're talking about trying to bring in the New York ISO, which is the organization that controls the grid, the power lines, and the substation on Hurley Avenue. Even though Central Hudson owns it, it is basically under the jurisdiction of FERC, which is the Federal Energy Regulatory Commission, and the ISO, which is the manager of the electrical distribution system in the state of New York. This is designed to be a widely attended public session in a larger venue than this, so that Jolie, that those people that you want to be educated, they can come out and be educated. We will attempt to broadcast this and also put it up on YouTube so that it can be replayed for those who couldn't make it. This is a very complicated jigsaw puzzle putting together with all the resources. I'm also trying to get some experts in the insurance field who can speak about the comments on fire insurance as it relates to residents. So we are attempting to put together these panels for educational purposes. Does any members of the board have anything to say? Ed? May I have a motion to proceed to executive session? All those in favor? Aye. Thank you very much.
Diaz is Diaz ambulance.
No,
Oh,
Diaz is a drainage issue.